the Visionary Health Podcast.
Hi, Sybille. How are you?
Hi, Paul. I'm
Hi.
fine, thank you.
Again, you're in Koh Samui.
Oh, yes.
So today we're talking about cancer and women's health, and let's just get right into it. I was wondering, what is the most prevalent cancer that women have to deal with?
Paul, the most prevalent cancer is, of course, the breast cancer. I want to talk about today. We have a lot of other cancers, of course, in women, from endometrial cancer, cervical cancer, and ovarian cancer. And of course, all the cancers can be related to men and women, like colorectal cancer, lung cancer, or skin cancer. But the main for women is the breast cancer, because it's our breast is a symbol of our femininity. So it's for the women, it's the most frightening to get a breast cancer. So let's talk about this today.
Yeah, okay. So, like, what causes? Do we know what causes it?
Yeah, there's of course, you can have some risk factors. For example, genetic mutation where you're born with. We have two genes for breast cancer related to breast cancer or ovarian cancer. Of course, it's a lot of talk about lifestyle. It's we have in our books, in our school books, it's written when you get your first menstruation very early and come to menopause very late, then you are influenced by hormones in a long span of your lifetime. So maybe this could cause a cancer. Overweight is always a risk for cancer in every field, not only for breast cancer. Diabetes is a risk factor. And of course, poor lifestyle, when you do no exercise, have a lot of stress in your life. Some of the things you can control, like doing exercise, take care of your lifestyle, of your diet, or everything. And some things we cannot control, like a gene mutation, and of course, like being like because of our poor food, whether the ingredients in food become less from vitamins, or we are how to say, influenced by heavy metals or something. It's in our
Like,
environment, in the air and everything. Yeah.
right, toxic metals or heavy metals.
Yes.
So there's no one reason. Anybody that gets it could have different reasons because of the different
Yeah.
reasons that they've got it.
This is the same thing. You cannot say this is the only reason and you cut it out of your life. There are a lot of reasons. It's always multi-reason. Multi-reason? Yeah, something.
What about family history? How does that play into it? It
Yes,
doesn't
of
mean that
course.
just because your mother had it, you'll have it, does it?
No, that's not. But when you have in your family, you have like your grandmom, your aunt, your sister, your mom, then of course you have to think about this gene mutation. It's called BRCA1 and 2. You can check for this with testing, of course. And also then it's not, of course, 100% that you get breast cancer or ovarian cancer. These both in this gene mutation are close together. But then you have to check yourself more. And it's also in some families without a gene mutation that when your grandmother have it, you have to be more aware to go for screening or something like this. Yeah. But it also comes to everybody.
Yeah, I want to talk about the screening in a minute, but I was just wondering, like, if someone you mentioned ovarian cancer as well, and I had read somewhere a while ago that there's a risk that if someone has breast cancer, tell me if I'm right with this. There's a risk if someone has breast cancer, they could at some point also get ovarian cancer. Is that right? That it's linked in some way?
Definitely, if there's a link with this mutation, yeah, when you have a mutation, but if you have not, it's not really clear. But then there seems to be a risk also to get ovarian cancer. But till now, as I know, there is no, without this gene mutation, there is no link we have evidence for. Yeah.
And there's
But it's good.
Sorry, go on.
No, but it's good, of course, for women. And I know that women be a little bit more aware than men. I think so. I'm a gynecologist of their health, so they go to screening. And it's not only about breast, we can talk later about it. It's always a whole body check. And then of course you check on different things on as a gynecologist, so that you have a whole picture of the women, not only focus on the breast, of course.
Right. Okay. So you look at everything, but with breast cancer, if you have breast cancer, say in like your 20s or your 30s, and you're saying that it could, like, people could also get ovarian cancer, they could get it at the same time, or could it be like years later that it's like this link? It could be like the time frame. There's no way of knowing.
I cannot answer this question. So
Okay.
also in young women, breast cancer, it becomes more common, sadly, but it's very rare. You have the highest point of breast cancers after the 50s. Yeah. So this is from aging or something. And of course, you have women, when you have this gene mutation or other things, very young with breast cancer. But you cannot say that then they will get in 1 month, 1 year, or wherever ovarian cancer. This is absolutely not clear.
It's not clear. Okay. And so there's no exact, like you said there before, that with the age, what's the most prevalent age for someone with breast cancer? Is it, you said that people in their 20s due to the genetic
Yeah.
marker, but then
Yes. So
also
in my career, sorry, we have a little
no.
bit like
You're speaking. You go ahead.
in my career as a gynecologist and working in the breast cancer center for luck, the number of young women is less. The highest peak of breast cancer, and that's why the screening is also in this age in Germany and worldwide, is from the middle of the 40s, from the 50s up to the end of life, that you can get breast cancer or other cancer. This is related to aging, because our body, how to say this, our immune system, our self-healings, we are aging, and this self-healing system is aging too. So it's become a little bit more weak over the time. I don't want to make a compare to a machine, but it's like, when you use our body all the time, you have to care for it, but it's aging. It's a normal process. And then also cancer cells can pop up, because this self-healing, that we repair damages on the cells, become a little bit more slow. So that is the
So
highest peak, or the normal age for breast cancer is in the older age, from the
does
end
that
of the
mean that
40s.
as people get older, there's more prevalence for breast cancer? So if someone in their 40s, there's more people in their 50s getting it. There's more people in their 60s getting than their 50s. There's more people in their
Yes, but the highest peaks is between 50 and 60. I cannot say why.
Okay.
Maybe it's caused from menopause or whatever, but it is, and that's why the screening program. And for the screening, we just use a mammogram. It's recommended everywhere that you start at the end of the 40s. In Germany, it's 50 up to 70 to do it every second year, because then you have the highest peak. But this is, of course, not the only thing to check on the breast. Yeah.
Right. And this is something that's just occurred to me. I was also wondering about external, and I remember we spoke in a different podcast about the same issue with breast implants. Like, there's some fears. Sometimes people have fears, and I'm not sure if they're founded or unfounded, but whether that can cause breast cancer or has an effect on it.
Normally not. Normally, when you use high quality implants, you will not become breast cancer because of this material.
Right.
But there are some links, not really no. I think the most dangerous is when you have an implant. You cannot, you have an implant behind the tissue, the normal tissue and everything. Maybe you cannot see it really well when you do. You can do also mammogram, also with an implant, or MRI or whatever. Maybe it's more difficult, because at the end, one of the doctors, me or somebody, have to check on the pictures we make, if it is an X-ray, sonographic, whatever, to see everything. And of course, the bigger the breast, or when there's an implant inside, it becomes more difficult for us to really check on it.
Oh, so it actually because the implant's there, it makes it harder to actually see anything. And is that where
Yes.
the risk is? Ah,
Yes.
okay. And I know that we also asked the question before about just bras, different bras. Does that affect? I think it was someone asked the question about underwire bras. Does that
They
have an
said
impact?
you have this, yeah, then you have this metal, this with the metal, the brass, where you have, I cannot explain in English, sorry,
I
but this
don't have
could
them.
affect, there is, there are so many, not rumors, but there are so many opinions about it, but also on this, on different bras, wearing a bra or wearing not a bra, wearing a bra overnight or not, or whatever, there is no scientific evidence that this causes breast cancer.
Yeah. Okay. All right. Well, that's good, I guess. And so you talked about screening before. The screening. What's the different types of screening that's available? What's
So for the
most common?
screening, recommend by government and our scientists to do the mammogram. The mammogram every second year, from starting from the end of the 40s. In Germany, it's from 50 to 70. But with the mammogram, it's an X-ray where you press the breast very strong to see everything, and you can see a lot, but you cannot see every tumor just with X-ray. So normally, I would always recommend, when you have it in your family, just that somebody had cancer before, also to make a palpation of the breast. The gynecologist can do it, and make an ultrasound, because there are some tumors you cannot see in an X-ray, you just see an ultrasound. And also the other way, some like calcification or something you cannot see through ultrasound, you have to do a mammogram. So in Germany, in the breast cancer center, we put all together. Yeah, when the women came to me, I checked the breast by seeing it, because you can see also difference just on when you have the experience, just how the skin looks like, or is there a little scar or something look different. Then of course of the palpation, you have some tumors you can palpate, maybe the women themselves before, then doing an ultrasound, check the breast, and then doing the mammogram, and put it all together to have a really good overview. But of course, this is logistical for screening. Every woman from the 40s and the 40s or 50s is difficult. Yeah, so that's why every woman have to be aware to check herself. Also when something coming, little blood spots or coming out of the nipple or something. These are all things you have to be aware of. Yeah.
And so when they're like doing a self check,
Yeah.
any changes in the way the breast feels that should get them to the hospital? They should go, or not the hospital, but to their doctor to investigate it.
Yes, 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 I would do this. When you're still in your reproductive cycle, you will have it always at the end of the cycle, before the menstruation starts, that the breast become a little bit painful, because the gland inside is growing before the period comes, and you maybe it feels a little bit irregular. But when you feel insecure, better come and check it. When you feel or you see difference in the skin of your breast, like changing the color, or looking like the skin becoming more like an orange, so with these bigger pores, it's called pores, like you have in the face.
Yeah,
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 when you
yeah,
see
yeah.
something like this, or a retraction of skin, or the nipple or something, then please come, doctor have to check it.
So any changes really that you notice, you should probably get checked out. Okay. What about, like, is there any, like, how old are these tests? Like, I remember, like, as a kid, and I'm not young anymore. I would hear about mammograms, whether it be through television or news or whatever. The government telling people that they have to go and have a mammogram done, and so I know that's quite an old testing procedure. In fact, I
Don't know
remember when I
exactly.
was sorry.
Yeah. Sorry, I don't know exactly, but I think this mammogram screening is around now 20 years or 15 years. Yeah, the world become more and more aware of women cancer, of breast
Yeah,
cancer, and so
yeah.
then it all started.
Well, are there any sort of testing new testing techniques on the horizon that will be better that are coming on, or do you know of anything?
It's difficult. With the screening, for example, with a mammogram, you also have false positive. You can make really stress on women when you check, and then you say, oh, there is something, I'm not really sure. And then the whole machine started. It stresses everybody when you're afraid that you have a cancer. With a newer test, like with circulation tumor cells, we can find in the blood or other markers or tumor markers is also good. But then when you have them positive, you also start the machine for checking where is this cancer. There is not that you have a test that you see, okay, this is breast cancer. Yeah, but now with a newer cancer, you can see there are changes in the blood cells who say there might be a cancer or there is a cancer somewhere. But then you also have to do, of course, mammogram or CT scan or something. Yeah, but of course it's much easier, and a lot of women are afraid to get a mammogram because it's painful sometimes when you press the breast like this.
And if someone does have is diagnosed with cancer through these testing procedures, what's typically their next steps? Like, what do they what could someone expect to have to go through?
So when we found a node, a suspect node by mammogram or sonogram or whatever, then normally the first step is to diagnose it by a biopsy. You make with a little needle, take a little thing out of this tumor and check it if it is a cancer or not. And if it's yes, then you have to start the procedure. So normal procedure is when you have a smaller tumor and you check everything like lung and bones and liver, and you see for luck there is no metastasis anywhere, you will discuss with the women first the operation. This could be that you just take out the tumor and the first lymph nodes from the axilla who are connected with this tumor, because when a tumor starts to spread, it can be also in the lymph nodes. And when you see these first, we call it like, I don't know the English name. It's like soldier lymph nodes. The first one, when the cancer cells spread from the breast, they will do to the axilla in these first lymph nodes. And when you take them out and then they are free, our opinion is then there's nothing in the body, just in the breast. So when you take out just a tumor from the breast, you can make a good reconstruction of the breast, that you will not see anything later that you cut something out of the breast. Totally different, of course, from an amputation.
Right.
And after this, you have much more material to check on, and you can check on how big was the cancer, different characteristics, if there are some hormone receptors, if there are some other receptors. And then, because it's not enough for breast cancer just to take out the tumor from the breast, however you do it, we know cancer is always a whole body situation. So you have to care in the whole body, because it could be, as I told with the new screening test, that there are some sleeper cells, circulating tumor cells somewhere. And that's why you have something more to go with, like a police to your whole body. This could be, of course, chemotherapy, and this could be like an anti-hormone therapy, or you get
Yeah.
other targeted therapies. So you have different characteristics, or you can have, on tumor cells for breast cancer. Some have receptors for hormones, the normal female hormone, estrogen or progesterone. If you have this on the tumor cells, you can do an anti-hormone therapy, because every hormone in the body, and also when you're in menopause, your fat under the skin produce estrogens. And when they connect with the tumor cell, it could be an activator for growing more. And one of the therapies, it has nothing to do with chemotherapy, is an anti-hormone therapy. You give it over years, and then every cell around with these tumor cell around with these special receptors is blocked by this anti-hormone therapy and will die. And there are other characteristics on the tumor cells. It's called different receptors, has nothing to do with the hormones, but also for this you can get target therapy. So every tumor cells running around with these special receptors is catched by this target therapy. And of course you have also the radiation. From the school medicine, we know when you just take out the tumor out of the breast and you let the healthy breast tissue there on this side, it's better, in our school medicine opinion, to make radiation on this breast, that it's like a clearing up, because a long time ago when there was just taking out the tumor, doing nothing else, the recurrence of tumor is more. So
Right.
the normal pillars for breast cancer is to make an operation and then do some things. You can combine it all together, or you just pick up what fits to the tumor characteristic, to doing something like a whole body treatment. Chemotherapy, of course, it's hard and has so many side effects that nobody wants to do it really. And anti-hormone therapy or target therapy. So this is the normal pillars women will be confronted with.
Okay. And then, like, when you're going through that, I imagine that, it obviously has an effect on your mental well-being. I mean, different people respond to things differently. What would someone typically, like, what do people usually go through? What sort of thoughts do they usually have, and how do they deal with them? How can they deal with them? I know you're not a
Um,
psychologist, but
yeah, but so when I have the ambulance in the breast cancer center, and you have to talk with women and give him the first time the diagnosis and they have cancer. It's also hard for a doctor because you didn't learn this in university, and you have to tell women that their life is in danger. So there are different reactions first time. Some just stop talking, some people are crying, some people are screaming and become very angry on you or the doctor because you are the one giving the diagnosis. And then it's so important just to let them in this situation, but then start, that is not everything lost. And it sometimes it takes an hour, because you see it is going one ear in and all the information you give and one ear out. So that's why it is so hard to work in a normal clinic. Of course, there's the time management. You just have 10 minutes. Then you have to let the patient go. But on this first time, it's so important to repeat and repeat and repeat again what you found. Let the women cry or scream or whatever, but then start again and maybe make another appointment. So you have different reactions. And I think nobody can really imagine when he never was confronted himself with a diagnosis of cancer, because then it's as like dying become more reality. Of course, we all have to die one day, yeah. But when you're confronted with a diagnosis with cancer, everything what was important for you, like to go to a theater in the night or something, becomes so unimportant. This was a normal reaction I see, and your world become like gray. It's so frightening, yeah.
yeah,
And then at the doctor, of course, I'm not a psychologist, but then it's always good when you listen and when you take care and give the women or whoever, also men, of course, the feeling that you understand and you are here for them, and that you really listen, and that they always can ask you. Because I know women waking up in the night have so many questions. I always told them, write everything down, because maybe you forget, and ask me next time. That you really always give the feeling that you're not just a doctor saying something, that
yeah,
you give the feeling that you're there for these clients.
yeah. It's got to be a very difficult thing on both sides. I mean, obviously the patient's got the worst end of it, but it can't be easier being a doctor delivering that news.
And I have to say now, because it all sounds so sad, but because of the screening and because our women are really aware of their body and come in a very, and as I said, when you see something change, better ask somebody, a specialist. And when we found cancer like breast cancer in a very early stage, nothing is lost. You can heal it. And this you have to say too. There is nothing lost. You just have to go away. Maybe it's a hard way, but then everything is fine again. Yeah, it's nothing lost when you're diagnosed with cancer. Nothing.
And of
Yeah,
course,
because this is how it's changed of screening and self-awareness and everything, that the most type of cancer you find in a very early stage, and then everything will become good at the end.
yeah. So the earlier you find it or pick something up or see a change, that early detections gives you that edge, doesn't it, in the treatment cycle?
Yes, and I want to say another thing. We now talk about very specific treatments for breast cancer, but of
Yeah.
course you have to treat the whole body, as we always say. You have to strengthen your immune system. You have to balance your lifestyle. What are you doing? It's not all about them making operation or something else. Of course, you have to think about, and this is also what you should do as a doctor. Ask about the life. What is it? Do you have a 20 or 100 hours job every week? Well, what is about everything? Yeah. How is your diet? Check on other things in the body, like chronic inflammation markers. We have all vitamins or everything. And then, of course, to add this, because everybody have a self-healing system. And the body but needs, of course, ingredients that he can build up on this self-healing system. When he's in chronic stress and all the storage of vitamin, minerals, whatever is empty, then he cannot do anything. So we need to focus on this too, not only on these radical things like surgery, also, of course, on everything, the soul, mind, our self-healing system.
It's good that you're saying that sort of stuff. I haven't had cancer, and I hope I don't get it. But some family members of mine have, and I've watched them go through it. And one of the things that really struck me, not just the first time went through it, but the second and the third time, is it seemed to me that um, I'm not directly criticizing the individual doctors here because I don't know their training, and but it just astounded me how single focused they were on a line of treatment, and not they didn't look at the external things. Like I remember I was in a consultation room, um, just to be there, and at the end of it, I asked the question, well, what about sort of alternative approaches? You're putting this person on chemotherapy. Do you have an objection to them being like go on vitamin therapy, or looking at other means of thing? And his response, he was quite honest. He said, look, I don't have any experience with those therapies. I've got no objection to them, but I don't have any experience with them. And for me, it was a bit it was disappointing, I thought, because it was like I was hoping that he would say, I think you should go and do these types of therapies. They don't interact with the therapies I'm giving. They're fine. But he didn't give any indication of what was good or bad. So you didn't know whether, you could go off and have acupuncture and maybe it's making it worse. Maybe it's making it better, but you don't know. So that's something that I thought that they would be able to give that answer. And maybe it's just because medical science just isn't there yet. Maybe they can't do it. But that was the expectation that I had. I thought the doctors could say that type of thing. I thought they could give guidance on that. Do you have any thoughts on that?
Yeah, I don't know why many doctors react like this, or it's not going hand in hand. But the future should really be. You cannot blame on the school medicine, of course, but you have to do something. And maybe we should not call it alternative, as we say in Miskawaan, it's integrative medicine. Yes, you should put it together. You cannot say you don't need a operation. Sometimes you need it, but the outcome of the operation, when you put, like you said, putting some vitamins for pain management, you can do some acupuncture and everything. Yeah, it's much better maybe at the end. When you need a chemotherapy, when everybody on the world agree to this chemotherapy, yeah, then you can do a lot of things to the body that he can cope better with the chemotherapy. Yeah, so you have to put it together, and this must be the future, that the centers, like doing the old school medicine stuff, put together with some specialist, on the vitamin field, on the mineral field, also on acupuncture, also with psycho-oncologists. This is common in Germany in the breast cancer centers and everywhere, that you really focus on the whole, not on the body, on the whole human being, that you try to catch every field in the human being, soul, mind, body, and then of course cancer treatment. And when you do this, I think it's the most perfect we can do. It's
And
not. It's also later when we did the breast cancer treatment. Women are so interested for preventing then, and then of course all these things we do under those hard therapies like chemo and surgery should continue, like having a good lifestyle, doing exercise, take care of your body by good nutrition, make blood checks, not only if cancer coming back, also if your body is okay with his self-healing system and everything. It's all possible. It would be most great when you find find a clinic, something to have a whole package.
I was going to ask you, just like after someone's, say they've gone through the process of finding out they've got breast cancer, going through whatever treatment they have had to have, and they've come out of that and they've been declared cancer-free. I'm not sure what that means, but let's say that's what they say. Well, is there a good way to go about? Like you talk about lifestyle, improving that, but are there recovery programs, or there are things that someone can do to make sure that their body recovers quicker from not just from the cancer, but also from, let's say, if they've had chemo, from the treatment of the chemo, their body recovers quicker.
I can only speak for Germany because I know it. There is normal when you have all this treatment, you go in a rehabilitation program, like about 4 weeks, where you have, of course, a check by the gynecologist if everything is right, but also with a physiotherapist, with a psycho-oncologist, with a musician therapist, or somebody you can speak, and you be together with in this rehabilitation center with other patients who have the same thing. So there's also great making connection, that you don't feel alone with your cancer or something. So, but of course, the main thing is catch up the patient, that they're doing a lot of things for themselves, that they really think about it, and for they also have to come. There's a special treatment after cancer. You have to come, or not? You should come every 6 months to your gynecologist or other doctor you trust, that he check on you, not only the body, but you can ask all your questions, and the doctor is asking questions how it's going. So there's a very short time follow up for those clients.
One thing, and this might sound, I'm going to go back to sort of our original discussion on like the different types of cancers. This might be a silly question. Are there different types of breast cancer?
Yes, of course.
Okay.
There are different.
I didn't know that.
Mm.
So there are, and are some more aggressive and others less aggressive, or are they the same?
Yeah, I don't like the word aggressive, but it's
Okay.
a little bit like this. The breast cancer, you have different types from the tissue. The most common is that you have that tissue come cancer where you're how to say, from the gland and the milkways inside, call it ductal. So for the base there. Another thing is it's you have it from the surrounding tissue. Then sometimes you have more than one spot in the breast. This makes it more harder for treatment, like for surgery. Then a little bit more raw, but you can have a cancer just for the area where the nipple is and the tissue around. Then you also can have something like a precancer. It's also just from the milkways, and it cannot spread, but it have to be treated a little bit like a real cancer. This is one thing, as we talk about with the screening, you see it with microcalcification all in the breast, because these pre-cancer cells make a lot of microcalc, so you cannot see it normally in the sonographic. This is to say it simple.
Yeah,
But
okay.
they're different. And then you have how to say, I try to explain from my to my clients, you have the grading of cancer. Grade 1 is the most, is not so aggressive when we say like this. Grade 3 is very aggressive. And I always try to explain, because it's hard to explain, it's something you see under the microscope. But when the cells, they were normal cells turned into cancer cells. And when you see they are already broken up, doing different things, but they look like the tissue before, the breast cancer tissue, then you have grade 1. And when they changed more and more, the picture changed that you cannot see at the end what was his cell before, then it's something like grade 3. And of course, it's always better to just have grade 1.
Yeah.
Yeah.
It's early
And
detection.
when we talk about early stage, it's always about the size of the cancer, the grading, if there are lymph nodes already have cancer cells or not. But at the beginning, so it's always about the size and the grading for early stage or late stage. Yeah.
Why did you decide to specialize in treating women's health?
Yeah, I was always, I'm a woman, of course, and I always was interested in health. Yeah, I
Yes.
just want to say no.
Yes.
No, it's of course it's different. And when I started, or in former times, maybe women, I feel it, are not so interested, or not so interesting for how to say this. But breast cancer and everything, the society become now more aware. There are other illnesses we can talk about, like endometriosis, but this is also not today, but this is all specialized on women, and the world was not aware of this. So I like to help women, and yeah, that's why I became a gynecologist.
Like, what are the common misconceptions about breast cancer? I know we kind of touched on that a bit with, I guess, sleeping with bras on and that type of thing. But are there any other misconceptions that maybe people should be aware of?
Yeah, a big thing is about these hormone therapies. When you take birth control pill over years, or later hormone replacement therapy, there's not real that you can. Of course, it can activate the breast cancer, but it would be never the only reason. When you are, for example, overweight, it's more risk to getting breast cancer than you to take as a slim, sporty person hormone replacement therapy. So this is a big field. So that's everybody is afraid. Oh God, when I take hormones, I will become breast cancer. So easy is it? It's not so easy to say. Yeah. So don't be aware taking hormone replacement therapy or taking birth control pill.
So this is especially relevant for women who are approaching menopause or into them,
Yes.
into their later years, who are wanting to, or just trying to think of whether they should go on hormone replacement therapy. And that might be one of their fears, that if they do that, they might end up with breast cancer, and that's not necessarily.
It's not like this. When you have a good lifestyle, when you're not overweight, doing no exercise or something, you have always a risk. Yeah, when you're okay, it's totally fine to take hormone replacement therapy. And when you really need it because you're suffering from so many symptoms in the menopause, your life quality will become much more better. And this is also a very, very, very big factor when you have feeling good, have a good life quality, to stay healthy in every way. So this is you cannot see it just like taking no hormones, then you get cancer when you're taking them. It's all about life quality too.
Maybe we'll do another podcast on hormones in the future,
Yeah.
because I'd like to talk more about that as well. Um, I was just the last question I got was in relation to lifestyle, but you kind of touched on it already. Um, just in that, if you have a poor lifestyle, you're more susceptible to breast cancer, versus if you have a healthy lifestyle where you exercise, manage your stress, eat well, get plenty of sleep, you're less susceptible.
Yeah, and I must say now we always hear this, make a good lifestyle, and now I know that some people will listen. They have a night shift, they have a lot to do in their lives, they need to work a lot. Yeah, of course we cannot say it's so easy like this pictures everywhere, slim, athletic
No,
people
of course not.
lying on the sun, yeah. But you really have to think about what you can control in your life and what you really make you happy or make you more satisfied, what you're doing maybe more. I have over years 24 hours shift, but I have a lot of other things where I can compensate. So you have to think about what really stresses me, what really stresses me, and then please change this. And doing a little exercise is not to become the sporty Ironman or something, or doing every day 2 hours in the gym. Nobody have time for this. A lot of people have no time for it. It's really evidenced scientifically when you just walk 20 minutes every day, maybe with your dog. So it's not like going around slowly to doing some shopping. When you go to a forest or lake or whatever you like in nature, 20 minutes, this is much more benefit doing anything else. And when you really have no time, then make like these, how it's called, hyper inter.
Oh,
Um,
the hot, yeah,
yeah.
I know. Yeah,
So
high intensity
you can do
training.
so. Yeah, and a lot of people say better you do yoga. I can for myself, I don't like yoga, so I do different things. So search for the things you really like, that you don't have to force yourself to do it. Also with food, uh, choose a vegetable or whatever you really don't like. Don't force yourself to something you hate. And when it's really 20-minute walking, normal walking, a little bit faster, but normal walking is always good in nature. The best thing you can do. And it's for free.
Yeah, yeah. And I guess if you've got a beach, you can walk along all the better.
Yeah.
Isn't that what you do?
Sometimes,
Pardon?
sometimes too hot. Sometimes I
Oh,
really miss the forest in Europe smell of
um,
everything.
so
I have a very great, we really should do this. I have a very great I saw it like a lesson about these things I talk about. How high is your risk when you are overweight, when you're doing no exercise? Yeah, they make it very clear with numbers. Very interesting. Against these rumor, when you take hormone replacement therapy, then you will get cancer or something. Yeah, very
oh,
interesting. I have to check it out again. That
this is
I am
a course.
better prepared for this. It was like a lesson on a scientific congress, and I really liked it very much because they make very clear pictures on it, that you don't have to be afraid taking birth control pill or hormone replacement therapy, because there are so many other factors, much more, that your risk of cancer, and the hormone replacement therapy and birth control pill give you much more better life quality and also have some good benefits. Yeah. So like cardio disease or something in the menopause. Yeah, because the missing estrogen, the missing or go down for hormones in women in menopause not only causes hot flushes or mood swings, that you become a grumpy something. It's also make a lot of things to your body yourself. Yeah, it's to the organs. Yeah, so that's why it's good to have this therapy too. But this is really a big field. We should talk in
Yeah, yeah,
another.
yeah. We'll talk about. Actually, maybe this is a question for another day, but I was just wondering, is there a difference between the synthetic hormones and the natural, like the bioidentical hormones? Does it matter?
It's from the chemical process, of course. And the bioidentical hormones are from a yam root. It's a vegetable. Yeah. So from the effect, it should be the same, because the synthetic hormones are the same, produced synthetic as our body hormones. The other one are come from a vegetable or from a plant, better to say, and they connect with the receptors in all our body. That the symptoms and everything from the missing estrogens become low. A lot of people, of course, feel better to take plant estrogens and progesterone, but it's not like that we're eating this yam root directly. They are also produced in the lab. So it's also not absolute natural. This, I think we have to say too. Yeah, but the effects are really good. And we also use it here at Miskawaan with a cream, with a bioidentical hormone cream. And yeah, it's fine. It's very good for the clients.
Okay, all right, good. Yeah, I haven't read this paper properly. There's a paper that I sent to Andy on exercise and how it's used to protect against cancer progression. Yeah, it's a paper. I sent it to him. It's only recently come out. The title is Exercise-Induced Metabolic Shield.
But this exercise thing, yeah, it's old like Methuselah. It's in the official guidelines from German Prevent Breast Cancer. They are official guideline doing by, there's one congress in the world, it's called the ASCO every year. So it's all about these new cancer things. And there are guidelines. I don't know if it's I think US heads from Mayo Clinic, they have these guidelines like doing the screening. In Germany, you have it too for cancer. And it's really so old that exercise is one of the biggest things to prevent, because then your metabolism, everything changed and all the stuff's coming out in your body. Yeah, but moderate exercise. So it's so old, everybody knows this, but how to sell it? Of course, you can sell it with great gym things, but as I said, doing a walk in nature every day, 20 minutes, hey, come on, everybody can do this, but nobody can really make money with this. Just making people smile and feel good. Yeah, this is always the thing, making money with something. But when you're telling this your clients, everybody can do this. Everybody feel better then. And when you can say this is enough, then everybody is happy that he can prevent himself from dangerous things, any sickness or something, just with doing this walk every day. Not going to a gym, not buying something, not doing these crazy yoga things or something.
Yeah.
Just walking in nature. This is for everything is good.
Yeah. I guess it's like you say, you can't sell it. It's free.
Yeah. And it's also you can give it like it's a me time. Maybe people say, "Oh no, I cannot. I'm working in the city." Every city has a park. Bangkok has a park. Also, of course, New York has a park. Take your 20 minutes. You take 20 minutes to, I don't know, watch any TV, something, doing this or this. Or maybe when you're not far from work, take your bicycle every day or walk the way to your work. Also, when it's not in nature then. But it's so easy to put it in your daily life. It's nothing you have to buy a new sports dress, to do a membership or something. Just walk or take a bicycle, also fine. Easy.
It is. Okay, well, I think we'll kind of end it there for today. I've got no more questions. So thanks, Sybille, for your time. It's always a pleasure to talk to you.
Thank you, Paul.
I'll talk to you again soon. Thank you.
Hope so. Bye.
Bye.
Discover the secrets to a healthier and happier life by tuning into Miskawaan Health on Instagram and Facebook. Our team is dedicated to bringing you the latest insights on functional health and well-being. Join us on this exciting journey and be a part of a growing community of like-minded individuals. Visit miskawaanhealth.com to learn more about our mission and access a wealth of educational resources.